Okay, so some of you came up to me today asking about how I break down questions, and this is just going to be a quick, short little video about my process. So first thing to do is obviously read the question, but read it very carefully and thoroughly. So I'll go ahead and read it. Oh, come on, focus. Your patient is a 66-year-old male who is complaining of shortness of breath. He has a history of lung cancer. His shortness of breath started suddenly and reports that sitting upright makes it better. He denies chest pain, fever, or cough. His neck veins are flat and the trachea is midline, and no pedal edema is noted. Lung sounds are decreased on the lower right side and normal on the left side. His vital signs are blood pressure of 168/99, heart rate of 112, respiratory rate of 26, SpO2 of 90%. The AEMT should suspect. This is stuff that we've learned, so it should be fine. So first, read the question thoroughly, but then you want to determine what is it asking. That's the hardest part about the NREMT. Sometimes it's just what is it asking, and here it's just asking what should we be suspecting based on the given information. Next thing we want to do that I do is I decide in my head, is it a medical or is it a trauma? Because that's going to change whether I'm using the medical assessment page that we've been given or the trauma assessment page that we will go over soon, I think. After that, this is clearly a medical. There's no indications of like any sort of trauma, so like a motor vehicle accident, a fall, him getting hit with a baseball bat, nothing like that. Next thing is like buzzwords. What are some big important words that kind of like jump off at the page at you? Well, 66-year-old male is complaining of shortness of breath. Well, that's his chief complaint. Let's see what else. History of lung cancer, shortness of breath again, started suddenly. So it's an acute symptom, an acute thing, not a chronic thing. It suddenly started. Reports that sitting upright makes him better. So his position, sitting upright, letting the lungs stretch out with gravity. He denies chest pain, fever, or cough. Right there, that would be a pertinent negative. So shortness of breath, potentially you could be expecting some chest pain, but he's denying chest pain and he has no fever or cough. Neck veins are flat and the trachea is midline. So nothing standing out there. No pedal edema is noted. Lung sounds are decreased. There you go, decreased on the lower right side and normal on the left. So because he's having shortness of breath, we're going to want to listen to those lung sounds. And then I also go over vitals. 168/99 for blood pressure. Little high, not going to kill you. Nothing too worried about. Heart rate of 112. Okay, that's greater than that 60 to 100, but that's also not going to kill you. And it's probably a little bit faster because he's short of breath and he can't feel like he's getting a full-on breath. SpO2 of 90. That stands out because we want, 94 and up. So, get those gears rolling. Next thing to do is, what I do is I go through each answer. So here we have pneumonia, spontaneous pneumothorax, heart failure, and pleural effusion. So based on the information that we've been given here, I'm going to plug in essentially each potential answer and see if it makes sense. Okay, so pneumonia. I think Instructor Fowler went over it a little bit, but pneumonia is typically a lung infection that's just on one side. So you might hear decreased lung sounds. Well, that decreased on the lower right side, that kind of fits. But let's see what else we got. Spontaneous pneumothorax. That could also be a possibility because we're hearing those decreased lung sounds on the lower right side. That lung could be collapsing. However, neck veins are flat and the trachea is midline. So it hasn't flipped over to a tension pneumo yet, where we would see some JVDs, jugular vein distension, and maybe that trachea shifting over to where the good lung is. So that's a potential as well. Heart failure. What do we know about heart failure or CHF? Well, one of the symptoms of CHF, congestive heart failure, is pedal edema, because the heart isn't able to pump out blood quick enough, so it builds back up into the body, and your feet being at the lowest point of where gravity is, often it pulls down there. But here it said no pedal edema is noted, so probably not heart failure. Pleural effusion. Well, that's a possibility because we're having decreased sounds on the lower right side and normal on the left. So potentially, but let's trace back up to where he was sitting upright. It's better when he's sitting upright, that position. Pneumonia is just an infection of the lung. Position isn't going to affect it too much. It might. Spontaneous pneumothorax, well, that lung is collapsing. That your position, your body position, sitting upright, semi-Fowler, laying supine, isn't going to make a difference because that pressure is building in that lung. Gravity doesn't affect that. We already know it's not heart failure, so it's probably pleural effusion. Am I right? And then this is Pocket Prep, and it'll explain everything too. You can pause the video here if you want the answer. Anyway, this was supposed to be shorter, but I hope this helps.